So I'm Zoe, and I'm the project manager for Menopause Explored at Wellbeing of Women. This webinar today is the first in a series of webinars that Menopause Explored will be hosting. So between now and March next year, and each of those webinars will explore a different aspect of the menopause. So you'll learn lots today, but also if you want to join for more, we'll send out details of future webinars after this one.
Hi everyone, I'm Liz Cunningham and my business is Menopause Reality. We use immersive films to share women's own experiences of the menopause. And together with Diane, I've been working with Wellbeing of Women for the last couple of years, delivering live in-person workshops to SMEs. And we're really pleased to be doing the first of our series of webinars today. I'll let Diane introduce herself in a second, but just to let you know the format today, we've got 45 minutes. It's very much an introduction today. So we will do 35 minutes of I'll ask Diane some questions and she'll share her experience and knowledge about the menopause, and then we'll have 10 minutes for questions at the end. So if any questions pop up, please pop them in the chat and we'll try and cover them off. Any that we don't, we'll save for future weeks if you want to join us for the future webinars and the rest of the series. So I'll pass over to Diane.
Thank you, Liz. Thank you, Zoe. Good afternoon, everybody. I'm Diane Danzebrink, the founder of Menopause Support and the National Make Menopause Matter campaign. As Liz said, we've been working with Wellbeing of Women on the immersive project in person over the last couple of years. So delighted to be able to bring some of that knowledge to these webinars and hope that you will join us for the series of 5 as we go through the months. So Liz, back to you.
Okay, so Diane, you are founder of Menopause Support and you have a campaign which is called Make Menopause Matter.
Indeed.
So start with the question, which is why should we make menopause matter? Why does it matter?
So it matters because approximately half of the world's population are going to experience menopause directly. So we know that the world population now is in excess of 8 billion people. The other half will experience it indirectly. So they're going to know somebody who will experience menopause. So it could be a partner, a friend, a family member, or a colleague. We also know that individual experiences of menopause can be diverse, so it can affect people in different ways. There is no one size fits all. When we're thinking specifically about the workplace, we know that we currently have more women than ever in the workplace and more women than ever over the age of 50 in the workplace. So that's one of the highest growing demographics. And that's without all of those who are experiencing perimenopause, surgical menopause, medically induced menopause, etc., etc. And then finally, we need to make it matter because if people come to this time in their lives, however menopause might occur for them, it gives them the opportunity, when they have the right information, to be able to make informed decisions for themselves. And all of those who are going to be in a supporting role, it enables them to be able to feel more confident to support more effectively.
And you do often mention, Diane, that in order to be able to support people, that you first need to understand. So let's go to a really basic question and ask, what is menopause?
Well, it's an interesting question because it can be different things for different people. So for many people, probably for the vast majority, menopause will occur as a stage of their lives, generally beginning in their early 40s to their mid 40s with something called perimenopause. So perimenopause occurs because essentially the ovaries are running out of their store of eggs, or what you might hear called oocytes. So every female is born with a complement of oocytes in their ovaries, and as they deplete to a particular level, the hormones that fluctuate on a monthly basis will start to fluctuate more regularly and sometimes more significantly. This is what brings about perimenopause, and this is for many when they may start to experience symptoms. That's then followed by a second stage, which is the clinical definition of menopause, which means when somebody has had a continuous 12 months without a period. And that is followed by post-menopause. So that's all the years that somebody will live after they've experienced those 12 months without a period. So that's one example of menopause. That's the one that most people will experience. But there are also other types of menopause, including surgical, medical, early, and premature.
Okay, do you want to talk briefly about a little bit about each of those? Maybe if we start with premature, because then you can explain to us when a more standard menopause happens and when an early menopause would happen.
Yeah. So as I said, for most people, their menopause experience will begin probably in their early 40s. For some, their perimenopause may begin in their late 30s, but for many in their early 40s. For the vast majority, they're perimenopausal by the time they're 45. But if you're experiencing a premature menopause, this will happen under the age of 40. So currently we know in the UK approximately 1 in 100 under 40, 1 in 1,000 under 30, and 1 in 10,000 under 20 experience a premature menopause. For many people, the cause of their premature menopause is known clinically as idiopathic. And unfortunately, what that means is that doctors don't really understand why that has happened. For those who will experience an early menopause, that's between the ages of 40 and 45. For some people, they will experience a surgical menopause. So that's clinically known as a bilateral oophorectomy. So that means that both of the ovaries are removed at the same time. So that's instant menopause. And then for others, they'll experience a medically induced menopause. So this is where somebody is having medical treatment which has an effect on their ovarian function. So people may have heard of others who have perhaps experienced a diagnosis of cancer where they've had chemotherapy or radiotherapy, which has had an effect on their ovarian function, and this has put them into a medically induced menopause. For some people, they may know somebody who has had a type of treatment for perhaps endometriosis or for PMDD, premenstrual dysphoric disorder. And this again is where one of the potential treatment options is to have the ovarian function suppressed, but that equally can bring on menopause. So in summary, menopause can be what you might hear called a natural menopause, which is spontaneous. You might have heard of premature menopause, early menopause, surgical menopause, or medically induced menopause. So it can be very diverse.
So you've described there the sort of diverse different types of menopause, if you like, that you can go through.
Yeah.
How does the sort of diversity of experience knit into that? So the people I mean, that's a big
How long have we got?
How diverse can the experience be? Is it the same for everybody? I think
significantly diverse. So there are some things so when we're thinking about an individual experience of menopause, we have to sort of widen the lens and think about what else might be going on for that individual as part of their menopause experience. So some of the key things that we often look at when we're particularly working with individuals who are experiencing menopause is perhaps, have they ever experienced hormone sensitivity? So have they experienced PMS, PMT, premenstrual dysphoric disorder? Have they perhaps experienced something like postpartum depression? Are they somebody who is hormone sensitive? Do they have that hormone sensitivity, which would tie into those things that I've just spoken about? Are they somebody who is neurodiverse? So we're starting to see some interesting research in terms of neurodiversity, hormone sensitivity, and potential vulnerability for individuals as they approach menopause, because they're all related. There's a relation to hormones for all of those things. We also have to think about things like gender. So for the vast majority of individuals who will experience menopause, they are females who identify as women. But we also have to remember that we're going to have friends, family, colleagues who are transgender men or non-binary. And some of those individuals can also experience menopause. We also have to think about culture and how perhaps that might play into the kind of help and support, the kind of information that somebody might have. So we know that there are still some cultures around the world where there is no word for menopause. So it's very difficult to speak about that. We also have to think about somebody's socioeconomic situation. We have to think about sort of all of those things and how they might fit into a particular individual's experience. And then if you widen it again, we also have to think about, what are people juggling in their lives? For a lot of people, this comes at a time in their lives when they are perhaps at the peak of their career, but they also might have extended care responsibilities, perhaps for older relatives, etc. So, we really do have to very much individualize this.
And I guess this is something that's come through a lot when we've worked together previously in the workshop sessions and the films that we've made. This background that people bring, their own circumstances, definitely seems to have a big impact on how the different symptoms might impact one person versus somebody else. So let's go into the really big question that everyone often has, which is, how many symptoms are there and what are the symptoms? Can you talk us through, can you take us on a tour of the menopause symptoms?
So in terms of symptoms, there are, if you look at sort of menopause societies around the world, you will see similar symptoms on all of them. So there are there's a recognized number, which is generally in the 30s, but that can extend for individuals. So I think in terms of symptoms, we have to think about the categories that the symptoms fit into. So we're really talking about physical, cognitive, and psychological symptoms. So I'm sure that many, many people watching this have heard of hot flushes, night sweats, and are aware that eventually periods will stop. But we also have to think about things like heart palpitations, achy joints and muscles, perhaps things that people might not have considered in terms of menopause. So things like dry eyes, dry mouth, perhaps changes to hair, thinning and drying, perhaps itchy skin. Really common to hear about people experiencing itchy skin, restless legs, and having no idea that those symptoms can be related. It's also common for people to experience changes to their sleep pattern. So perhaps where you can go to bed and go to sleep, but you're not getting a good night's sleep. So your sleep is being broken. Then in terms of cognitive symptoms, they're often described as brain fog. And what we're really talking about here are changes to memory and concentration, which, if you don't know that that can be related to menopause, can be really worrying. And then the psychological symptoms. The psychological symptoms are the ones that we hear reported the most regularly, and probably the ones that, for a lot of people, they experience early, but they don't necessarily relate things like increased anxiety, low mood, mood fluctuation, or even changes to levels of confidence as being something that might be related to those hormone changes during perimenopause, or it could be a swift change due to surgical or medically induced or premature menopause, etc. And then there's a set of symptoms which don't really get spoken about nearly enough, which are the genitourinary symptoms of menopause. So these are things like increased urinary frequency and urgency, urinary tract infections, and vulval and vaginal symptoms. And it's really important that people know that they can be part of a menopause experience, because they're widely experienced, but we often hear from people who have been experiencing those for some time but had absolutely no idea.
And what you've just described is a really, really broad range of symptoms. Why are they? What is it that's what's happening in our bodies that can cause such a wide impact, and physically, mentally, cognitively, etc.?
Yeah. So I think the first thing to say is that around 1 in 4 reports that they experience very few or no symptoms. So symptoms won't affect everybody. Around 3 out of 4 do experience symptoms, and around 1 in 4 describe their symptoms as debilitating. So as I said, what's causing those symptoms is in the experience of probably the vast majority, as the ovaries begin to deplete to a critical level in their eggs or oocytes, the hormones that usually would change on a monthly basis are actually changing more regularly, and sometimes quite significantly. So if we think perhaps we're talking about progesterone and estrogen. If we think about estrogen can fluctuate up and down on a very regular basis. So it's those hormone changes that are precipitating those symptoms. And obviously, for somebody who goes into a surgical or medically induced menopause, where either your ovaries are removed or your ovarian function is disrupted in terms of it being suppressed, that can happen quite quickly and very significantly for some people. Not for everybody, but for some.
And I guess that's why education is such an important thing, because how on earth would you know to connect dry eyes and brain fog and a UTI, a recurring UTI, and go along and present them somewhere, because they're all so different, so you wouldn't know to connect them. But so for anybody who's gone through that list and mentally just made a little tick list of yes, what are the options for managing them?
So, I mean, the options again, like the experience of menopause, the options are varied and should very much be about informed choice. So we've talked about, sort of having the information and the education. Ideally, everybody should also have the information about what their options are for managing menopause symptoms, if that's what they choose to do. So in terms of sort of national guidance, we've just seen an update to NICE guidance, which originally was published in 2015. We had the update published last week. So the first line treatment, should somebody go and see their GP or their practice nurse, the first line treatment, which means that it's the most effective treatment for symptoms, is HRT, otherwise known as hormone replacement therapy. Now, that would be an option for the majority. There would be a small amount of people where it would not be first line, and that would be something that they would need to discuss probably with a menopause specialist as to what their options around that were. So for somebody who has a complex medical history, it's likely that they would need to see somebody who specialises in menopause, unless their GP is that person. So hormone replacement therapy comes in lots of different forms. It comes as patches, gel, spray, and oral tablets, depending on who you are. Depending on whether or not you've had a hysterectomy, depending on whether or not you're having periods, that would inform the type of hormone replacement therapy and the regime that you would need. Then there are non-hormonal options that can be possibilities for those who can't consider hormone replacement therapy as first line or choose not to. We also know that some of the talking therapies can be helpful for some people. So in NICE guidance, CBT has been flagged as an additional sort of an adjunctive option for some people who might find that helpful. We also know that particularly for those who are experiencing pelvic issues, it can be very helpful to see somebody like a women's health physiotherapist. As I said, we do have NHS menopause specialist clinics, and anybody who has a complex medical history and they need to see somebody who specialises can be referred into one of those clinics. And then, of course, once we sort of step outside of perhaps the GP route, there are hundreds of complementary possibilities. For some people, that will be their first choice. Just a couple of things to mention on that in terms of looking after yourself. If you're somebody who is already on prescribed medication, then it's really important that you take advice from a prescriber or a pharmacist about whether or not anything that you buy over the counter might perhaps have contraindications with any prescribed medication that you're already taking. So that's really important to do. And in terms of the kind of supplements that are out there, it's also really important to do your due diligence around making your choices for those. Lots of people will look at sort of other complementary options, things like yoga, Pilates, Tai Chi, mindfulness, meditation. A lot of those things can be helpful for people. And then, we also know that for some people, they find it very helpful to be able to have somebody to turn to somebody to talk to. So there are organisations out there that can help with that, but also for a lot of people, they will find that speaking to a therapist can be something very useful for them. And then we have to think about what we can do for ourselves. So things like looking at our own nutrition, our movement. It's really easy to say, look at your stress levels, but actually making some micro changes can be really helpful for people. And then think about the things that perhaps might exacerbate any symptoms that you have. So perhaps thinking about things like alcohol, caffeine, spicy food, sugar, those sugary drinks. We know that some of those things can exacerbate symptoms for people. So just looking at everything that we can do to sort of help ourselves in terms of symptom control. But ultimately, Liz, this really comes down to each individual finding the right combination of things to help them.
And I'm going to ask a question that often comes up, which is how, what advice do you give to people about when is the right time to go and ask for help? How do you know when you should be getting some help with what you're experiencing?
Yeah, so it's a great question, and the answer is very simple. So when people ask me that question, my answer is always, is this having an effect on your quality of life? And if the answer to that question is yes, then that's the time.
And people's experience can be different depending on the healthcare professional that they speak to.
Mm-hmm.
Is there any sort of general advice that you can share about how to get the best out of that first interaction that you might have if you're thinking about speaking to a GP or a healthcare professional for the first time about this?
Yeah, absolutely. So I think it's all about the preparation. So be as informed as you possibly can. Make a note of your symptoms or complete one of the online symptom checkers. If you're still having a cycle, then you might track that with an app. You might keep a note of that in your diary, have those details to hand. When you make your appointment, ask if you can see the person in the practice who takes an interest in menopause. So that might be a GP, but it's also might be the practice nurse. They're not in every practice, but we are seeing that more and more. It's also worth asking if there's an opportunity to have a double appointment, because it's a lot of information to get through in one appointment. And you may well find that you need an initial appointment to share everything and perhaps get some feedback from your GP or practice nurse, but then have a second appointment so that you can go back and discuss what your informed choices are, and to have discussions around regimes, doses, etc., so that you can feel confident with whatever it is that you decide that you would like to try.
That's great, thank you. That's good advice. So just to say that there'll be some resources that will be shared with everybody from this webinar, but I know that there are some symptom checklists which are quite useful things to take along to those meetings. So if you'd like a link to that, I think that they'll be shared after the webinar. So our next webinar in December is going to dive a little bit more deeply into this. So the idea today is about an introduction broadly to menopause. And in our next webinar, we're going to be talking a little bit more about support in the workplace and kind of best practice and how to provide that support. But just touching on that briefly now, can you give us a brief overview of how the menopause does tend to affect people in the workplace, what people tend to experience?
Yeah, so as I said, it's very individual. You know, there is no one size fits all, and you could have two individuals with the same symptoms, and it would be a different experience for them both, because those symptoms might be different in length, breadth, and depth. You might have completely different life experiences to that point where you start experiencing symptoms. So people are juggling different things, and people might choose to manage their symptoms differently. So there really is no one size fits all. But I think some of the things that we've seen very broadly, sort of over, like my decade working in this space, is that certainly the cognitive and the psychological symptoms can be very challenging for people. As I said, the initial challenge is generally that people don't recognize that they're remotely related to whatever their menopause experience might be. So if people start to develop increased levels of anxiety or low mood, or they suddenly find that they're less confident in themselves, but nothing else has changed in their lives, then that can be really worrying, because then your anxiety is upped because you're stressing about being anxious, essentially, because you don't know where it comes from. And of course, we all know that if we're feeling anxious and stressed, it makes it more difficult for us to concentrate. So that's a sort of byproduct of the not knowing. But then equally, those cognitive symptoms, those changes to memory and concentration, they can be really worrying. I can't imagine the amount of people that I've spoken to over the last 10 years who have said, I was so worried, I thought I might have dementia. And as soon as you start to speak to them and say, actually, I hate to say it, but what you're saying is really common, because we speak to people all the time who say that that was their fear too, because they didn't know. And this is why the information and the education is so vital for everybody. So, of course, if you're struggling with memory and struggling with concentration, that can have an effect on you. It can affect, your own levels of confidence. So, again, that's kind of a byproduct. And then maybe some of the ones that people might not particularly think of as having an effect in the workplace would be, we often hear about people having hot flushes in the workplace. I think people are familiar with that. But perhaps some of the things that they don't necessarily consider are the musculoskeletal effects. So, having painful joints, having achy muscles. If you do a physical job, that can have a really significant effect. Perhaps for those who, I think we often think that menopause means that periods become lighter and further apart. And unfortunately, the truth is, for some people, they get heavier and more erratic. And that, again, a side effect of that can be that people are worrying about, is there going to be an issue where perhaps I bleed through my clothing? I've supported several people where that's been the situation for them. And in a workplace environment surrounded by colleagues and perhaps not being close to the toilet facilities or not having anywhere to store anything, or perhaps struggling with frequent urinary tract infections where, that's a very uncomfortable thing to experience anyway and can affect your levels of concentration, but also means that you're probably having to make lots of visits to the toilet facilities and, are they close to where it is that you work, to your particular work location? Are you becoming very anxious about having to leave it might be your desk, it's going to be different things for different people depending on what their job is. So I think there is a really wide variety of the way that symptoms can potentially impact people in the workplace.
And we will get into this a lot more deeply next time. But if you could just give one bit of advice to any employers or line managers who might be responsible for teams of people here, what can they do to support?
So I think the most important thing to say is that it's very difficult to support something that you don't understand. So if you don't know anything about menopause, thank you very much for joining. We're delighted to have you here. But you might want to go away and expand your knowledge. I know Zoe's going to send some resources for how you can do that with some of the resources that Wellbeing of Women now have on their website. So expand your knowledge, but also recognise that anybody who may be asking to come and speak to you about their experience of menopause, recognise that it's probably taken them a significant amount of time to ask for that meeting. So give them lots of time to explain what it is, and ask people what you could do to help. So ask, don't tell, essentially. And I think that's a, I think that's a good piece of advice in any situation where you're supporting somebody, because what helps one might not help another.
Definitely. I think that's great advice. Okay, thank you so much, Diane. There was a lot of information shared there, and hopefully everybody's found that helpful today. We're going to move on to some questions, and I'm going to start with one that was pre-submitted. It's quite a long question, but I want to do it justice, so I'm going to read the whole question out to you. If anybody else we've got a few more in the chat, but please, while we're answering these early questions, add anything else that that you'd like Diane to be able to answer. Okay, so here's a question, which is how to break the ice, particularly with male line managers regarding our gynecological concerns around menopause, periods, and menstrual health. There have been many discussions around the UK regarding the need of full understanding, support, and compassion from managers, especially when these concerns are discussed in parallel to the lack of women's restroom facilities at workplaces. How to make sure when these two things are discussed with managers, our concerns are heard and are acted on compassionately and swiftly. So from the employee's perspective.
Yeah, so ultimately, this all comes back to what we just spoke about, which is education and information. How can you ensure that those things are going to happen? Well, the only way to ensure it is to ensure that the line managers feel confident enough to be able to speak about it. And the only way you feel confident enough to be able to speak about something is if you understand it. And I think it's really encouraging that we have seen so much, particularly over the last couple of years, in terms of, menstrual health and menopause being a much wider conversation in the workplace. There's clearly still so much to do. But one of the things that I would say, sort of bearing in mind where we are at the moment, and knowing that that education and information is not universal, and perhaps your own line manager doesn't have that information and education, and they don't feel confident and they don't really understand how to support. I think the other thing, which we'll probably come on to more in another session, is about who is the best person. So when I work with individuals, I will often they'll say, I don't think my line manager is the person that I really want to speak to about this. And it's like, okay, that's absolutely fine. So who would be, what other options do you have within your organisation? And obviously it very much depends on the size of the organisation. So if there is an option to speak to somebody in HR, then that's a great option. There might even be a menopause advocate within the organisation. We're seeing that more and more. So I think from an employee's point of view, it's about maybe sort of widening your options in terms of, if you're thinking my line manager isn't necessarily the right person, then who else could I possibly have this initial conversation with? And is there maybe somebody within the organisation who could help to facilitate that conversation with the line manager? In an ideal world, everybody would have the education and information and feel confident to support in these situations. But I think we have to be realistic and recognise that where we are at the moment, that isn't the situation, but hopefully we're moving in the right direction.
Okay, thank you. Okay, I'm going to ask a couple of the questions from the chat here. I think this is from Geraldine. Could you discuss how menopause can sometimes trigger or exacerbate pre-existing conditions such as Ehlers-Danlos syndrome, apologies if I've pronounced that wrong, hypermobility spectrum disorders, which can also give chronic fatigue and brain fog?
Yeah, so there are lots of potential sort of pre-existing conditions that people feel that are exacerbated by menopause. We could equally talk about, as I said, kind of there were sort of some of the hormone sensitivities, neurodiversity, but there are other conditions. I think it's really important to recognize that this also is something that is not necessarily a one size fits all. I think, kind of this does sometimes come down to individual situations, but I think probably a good way to think about it is that we have estrogen receptors from the top of our heads to the tip of our toes, and they affect so much of the body's functioning that with each individual, whatever they are, whatever their situation is as they approach menopause, those hormone fluctuations can have an effect, not just with those symptoms that we talked about, but with pre-existing conditions too. And I think that is something that really needs to be discussed with either sort of a specialist that individual is working with for that pre-existing condition, or it's something that needs to be discussed with a menopause specialist who will take a complete medical history.
That's great, thank you. There's two questions that have come in that are quite similar, so I'm going to try and summarize them between them, because I think this might be the last question that we have time for. So Leslie and Sarah are asking about having started HRT, that it seemed to make a difference initially, but several months in, symptoms are returning. And so if someone finds themselves in that situation, what next?
Okay, so if we talk about sort of the initiation of hormone replacement therapy, or in fact the initiation of any treatment, what should happen is somebody gets their initial prescription. The general guidance is to try it for around 3 months and then have a review. And if at 3 months, that review should be talking about, sort of the effectiveness, how that person is finding using that regime, etc. And if it's effective and all is going well, then that may continue on. However, if it's clear that things are not quite as good as they could be, so perhaps somebody has had a little bit of an improvement, but not as much as they would like, then it's up to the clinician to talk about essentially trying to optimize that treatment for the individual. Now, if that then gets to 6 or 7 months down the line, and somebody may or may not have had that sort of 3-month checkup, then it's absolutely worth making another appointment and going back and speaking to your prescriber. So whether that be your GP or your practice nurse, and essentially talking about what has improved, but what still could be improved. Or, as you said, it seemed to work for a little while and has stopped being as effective as it might be. So it's definitely worth going back and having that conversation about trying to optimize whatever it is somebody might be using to improve it.
Okay, so don't just accept if it's not an improvement. Don't just think that that's the way it is. There are other things that can be tried.
Absolutely. So, sort of different doses, different regimes, etc. Yeah, there are always options.
That's great, thank you. We have run out of time today, so thank you, everybody. I just wanted to remind everyone that that you will get an email as you registered for this webinar. You'll get an email that will have some links to lots of really great resources that Wellbeing of Women have pulled together as part of the Menopause Explored initiative. And this is just a plug to say, please join us in December for our next webinar. We'll be talking more about the workplace. Also, if you're based in Central Bedfordshire, Luton, Milton Keynes, we are still running our series of live workshops, so please get in touch with Zoe if you would like to attend one of those or have them in your workplace. Zoe, I'll pass back to you. Thank you.
Yeah, just to say thank you to Diane, thank you to Liz for hosting today, and thank you to all of you for attending. Hope that you found it useful, and if you've got any questions, you will get an email from me within the coming days, and please feel free to reply directly, and hope to see you at the next one.